Good morning, everyone. We have recorded 21 new cases, 15 of them linked and 6 still under investigation. 14 of the new cases were in quarantine during their entire infectious period. We are aware that 6 were infectious in the community and the movements of 1 are still under investigation. Sadly, I can report 11 people are now hospitalised with COVID-19 and 1 person remains in intensive care in a critical condition. And again, we extend our love and thoughts to the family of that person and our thanks once again to the wonderful staff in the intensive care unit at Canberra Hospital who are providing such compassionate care. Yesterday we had 3,500 tests. So a solid number, but not as high as we have seen. We do anticipate that increasing as there are thousands of people coming towards the end of their quarantine period. Now, yesterday the government finalised some minor changes to the public health directions that will be effective from midnight tonight and operate until at least Thursday, the 2nd of September, and possibly longer. Under these changes, small retail businesses will be able to have a maximum of 2 people enter their premises to operate a local contactless delivery service or a click and collect service. To counterbalance this, some of the large essential businesses that have been open to the public over the past 2 weeks will be required to move to a similar contactless click and collect or delivery service. This includes hardware stores, pet supply stores and office supply stores. These stores will of course remain open for Canberrans to access the essential items they need, but that access will be via contactless means, either order and delivery or order and contactless collection. There are some further amendments to the public health directions that impact real estate, cleaning services and waste management services. Further detailed information on these changes is available on the COVID-19 website. So I need to repeat that we remain in lockdown, and the reason for the lockdown is to restrict the interaction between people as much as possible to reduce the spread of the virus. So these amendments to the public health directions allow a small amount of additional activity at a small business level, but counterbalance that with addressing what has been a major issue of the most checked in places in Canberra in the last 2 weeks, being some of those large format hardware stores in particular. Turning now to construction. The government has been engaging with the industry over the past 2 weeks. The feedback we have received from the sector is that they are committed to enacting the strictest COVID-safe arrangements that would enable a staged reopening of construction. So subject to the public health situation not deteriorating over the next week, the government is targeting a gradual recommencement of construction from Friday the 3rd of September. This gradual recommencement would start with civil construction, new roads and suburban infrastructure, for example. It would also include the manufacturing, fabrication, testing and equipment supply that will enable construction projects to recommence. Large-scale construction projects on large site footprints will also be involved in this work. So the government is providing a strict set of COVID-19 safety requirements to industry stakeholders today for finalisation. This will include physical distancing and density limits of 1 person per 4 square metres on construction sites. Under a gradual recommencement of construction, these COVID-safe requirements will be strictly enforced by WorkSafe and ACT Police. And before the final go-ahead is given to gradually recommence construction on Friday the 3rd of September, we will undertake a final safety check mid-next week with advice from a Chief Health Officer. Now, as I outlined yesterday, the decisions that we make about future public health restrictions need to be careful and they need to be gradual, small steps forward. In the current climate, before we reach 80% effective community vaccination, we need to be very cautious. The future beyond the 2nd of September will be considered mid-next week and will be based on the public health information at that time. Turning now to vaccinations. In good news, the ACT has now passed 60% of our population aged 12 and above with at least one dose of a COVID vaccine. We continue to see strong vaccine take-up. I'm advised that 90% of the Territory's 30 to 39-year-olds have either received a first dose of a vaccine or are booked for a first dose of the vaccine. That is very encouraging for the Territory to go well beyond 80% community vaccination as more vaccine supply becomes available in the coming months. That is essential to give our community protection from our surrounding region, from the decisions of other governments beyond the control of the ACT, and to protect individuals, particularly vulnerable individuals who may not be able to get vaccinated. I'm also pleased to see that more and more people are taking the opportunity to get vaccinated now through a GP or pharmacist using the AstraZeneca vaccine. So in summary, 21 new cases overnight, 15 linked, 6 still under investigation. Sadly, now 11 people in hospital with COVID and 1 person remaining in intensive care in a critical condition. I'll now invite Dr. Coleman to provide some further detail on the new cases and the epidemiology of our outbreak. Minister Stephen Smith will provide a further update and then we'll take questions. Thank you.
Thank you very much, Chief Minister, and good morning, everybody. Good to be back with you today. My name's Karen Coleman, and I'm the ACT Chief Health Officer. So, as the Chief has said, since our update yesterday, the ACT has recorded 21 new COVID-19 cases, which brings our total cases for this outbreak to 211. The good news is that 2 of our cases have now recovered, and given we're at that time frame, we'll be able to report on recovery of cases every day moving forward. This leaves us with 209 current active cases. So of the new cases today, I'll also confirm out of the 21, 15 can be linked to known cases or ongoing clusters, which is good news. We know that 14 of these 15 are household contacts and the remaining case is from an existing cluster. So all that good work about people going and getting tested and identifying as close contacts is really paying off. Out of the 21, 14 were in quarantine during their whole infectious period and therefore posing no risk to the community. Of the 7 remaining, unfortunately 6 were infectious in the community for at least part of their infectious period, and 1 remains under early investigation. And sadly, as the Chief has mentioned, we now have 11 people in our hospitals, with 1 of these in intensive care and requiring breathing assistance. Since our last update, we have just over 3,500 self-identified close contacts and over 3,300 casual contacts. And if you've been paying attention to the numbers closely, In the last 2 days, that means we've released about 7,500 people from formal quarantine, which I'm sure has been an immense relief to people and also been a relief to us in terms of the large number of people who remain uninfected from being present at our exposure sites. You will also have started to notice that some of our exposure sites are now listed as archived on the website. This is part of the process now as we move forward. Exposure locations are archived once more than 14 days has elapsed since the date of exposure, with a couple of exceptions, and these can be found on our website. So in terms of current active exposure locations, there are 247 on the website. So to provide a broader update on the outbreak itself, at this time, there is very little change in the breakdown of active cases across age groups. So there's 37% of cases are in people aged 0 to 17 years and 46% aged 18 to 44 years. Again, the vast majority of our cases continue to be in under 44 years of age. 13% are aged 45 to 64 years and 3% are over 65 years of age. Our public sites of transmission remain at 10, with only 3 of those changing in cluster numbers since our update yesterday. Lyneham High School has increased from 41 to 46, and we've seen some of those coming through in these new numbers. They are our linked household contacts. Fiction Nightclub is up from 33 to 34, and Bright Bees Early Learning Centre in Nichols has an additional case. But I'd like to take the opportunity to talk a little bit about the numbers for Bright Bees has gone up from 11 to 15 today. While there's only one new case in the last 24-hour data, this is actually what happens when we continue to work through our cases with people with interviews and get new information. So what the team has identified is that 3 cases from the last 2 weeks are now able to be linked to this site. So therefore our numbers have popped up to 15, and it's why I provide some caution to you when we're discussing these, that these are why numbers can change a little bit in this space moving forward. I'd also like to take the opportunity to thank everyone for their patience as we work through our close contacts that are coming to the end of their quarantine period. There has been a large sum, as I've just talked to, and I'm aware that there are a lot of people who have had a few frustrations about our timeliness in doing that. All I can do is apologise again for that and endeavour to say that we are getting to you as quickly as we can. But I do want to remind everyone that only close contacts need to wait for contact from ACT Health, as advice for those who are casual contacts is very clear on the website, and you do not have to wait for us to get in touch with you. If you are a close contact, please remain in quarantine until you have had a negative test result on day 12 or 13 and you have been contacted by us. But just as a reminder, for assistance or advice in relation to this, please call the COVID response team and select option 5. The details will be very clear on the website. Today, my shout out to all Canberrans who have done the right thing and been patient and supported us as we work through our thousands and thousands of contacts over the last 24 to 48 hours. I'll now hand back to the Chief for questions, and thank you.
Okay, who'd like to begin this morning?
Chief Minister, you've indicated a staged return to construction from the 3rd of September. What kind of things have to stay the same to allow that to happen? Should we be looking at the number of unlinked cases as something that could derail that plan?
Well, what we've been particularly focused on is people infectious in the community and mystery or unlinked cases. So we want to continue to see those numbers as close to 0 as possible. That helps in a sense that there's not undetected virus out in the community that would then, at various levels of increased economic activity, be brought into workplaces and then back into homes. So what's clear, as I've said on a number of occasions now, is that if one person in a household gets it, it's most likely that everyone in the household will, and that close work contacts are also highly likely to infect each other and then bring it home, and then it then spreads from there. So what we are seeking to do between now and the point that we have very high levels of community vaccination is manage that risk. And that's what we'll be assessing and trying to balance every day between now and when we anticipate on the current vaccine rates reaching those high levels of community vaccination. And that would appear to be, unless there's a massive shift and massive increase in vaccination in the next month or so, that will be most of spring.
Chief Minister, Atagi this morning approved Pfizer for children aged between 12 and 15. Are you able to provide an update? Are you any more certain of when we will be able to start rolling vaccines out to that age group here?
We're told we'll be given an update on vaccine supply in National Cabinet this afternoon, so I'd hope to be in a position after that briefing to have a better understanding of what this means. I think this time round the Prime Minister was clearer about just taking bookings, I think from mid-September for that group, so as to not raise unrealistic expectations. But if Moderna becomes available as well as Pfizer in a sufficient quantity, then we can move quickly. I understand there's about 25,000 Canberrans aged between 12 and 15. So it's not a small cohort, but it is a manageable one. 2 doses, that's 50,000 we would need.
And as you kind of flagged up until now, our benchmarks here in the ACT of the 70 and 80%, they include those children aged 12 and above, don't they? So that will have a big impact on our path forward.
They are in the denominator. So what that effectively means is that rather than working towards a 345,000 or thereabouts denominator as what's your eligible population, it's more like 370,000.
The staged return of construction sees large operators being able to return sooner than smaller operators. Do you see the ACT government providing support to smaller operators in the intervening period?
Yes, the economic supports that are in place for those businesses and individuals who, by means of a public health direction, are not able to earn an income.
On the issue of schools returning, what's the ACT government's current plan to get students back in the classroom? New South Wales is talking about the end of October. Could you see face-to-face classes returning in the ACT this year?
I think I could see them this year. I think it's unlikely this school term.
And could you see vaccination days set aside for certain priority groups of students to enable them to get back into the classroom?
That's conceivable as well, but is all based on vaccine supply and some of the information that I hope to get later today and over the next couple of weeks.
Chief Minister, how close are we getting to people being able to enjoy a little bit more recreation outdoors, particularly I'm thinking community sport?
Difficult to speculate on that at the moment. We'll provide a further update by midweek next week on what the situation, based on what the situation is at that point. The more days that we have no one infectious in the community and no mystery cases, the closer we are to the resumption of things like community sport.
You don't want to give a glimmer of hope to our local footy codes who are, gearing up for finals?
I wish I could, but I cannot foresee what will come next. This whole experience, to use an analogy, is like driving, looking in the rear vision mirror. What we are seeing today is the result of people's behaviour and activities and interactions and where the virus was about a week to 10 days ago. So we get that evidence of what was happening. That can provide some indication of what might happen, but we can't be certain. So I'm not in the business of making grandiose promises that I cannot possibly deliver. I have been real, frank and honest throughout, more so I think than most other First Ministers, with this community in terms of our local settings and on what's been happening nationally. And I intend to continue that approach. So no false promises from me.
Minister, we're aware that there are 2 individuals facing court today for breaches of the public health directions, among a number of other charges. Can we have an overall update on compliance in the community, please?
So Chief Police Officer provided that update to Cabinet this morning. In summary, generally very good, with a few examples like the 2 that you have highlighted, who are facing a legal process as a result of the very poor decisions that they've made. Police have been concerned about managing the volume of people at certain large hardware stores, and that was a factor in our consideration around balancing risk associated with those stores and shifting them to contactless click and collect and delivery arrangements rather than having, I think in one instance, in one day, there were 19,000 check-ins at a particular hardware store.
Have you seen any cases connected to those Bunnings stores?
So there's certainly been exposure sites, and there have been exposure sites in places that have seen a lot of people. And so the implications of that are, see a lot of people in quarantine, a lot of people close contacts. That then has implications for workforce capacity. It flows through the entirety. So in seeking to balance risk to be able to do a greater level of economic activity across retail broadly, we've effectively brought into alignment to have that contactless arrangement and click and collect and delivery. We think that will provide a viable way forward. You can still access all of those products, you can do it safely, and auto-enable a safe pathway forward.
People waiting to leave quarantine have been quite frustrated by the process, and obviously ACT Health has to contact thousands and thousands of Canberrans waiting to do so. Could you see a change to that process to enable them to get an automatic notification or some other process to release them?
So there's a systems interaction, as I understand, and so what's particularly important is that the same name and date of birth is provided both in terms of the testing and then the declaration forms. If those 2 mismatch, that's where problems can emerge, but there are some system changes being put in place to address that.
With the retail changes, Chief, will there be consideration for any vulnerable Canberrans, for example, those without a vehicle to do click and collect or the extra cash for delivery?
Well, look, I think depending on the size of an order, many businesses will do free delivery. And I'm sure if a person is in a vulnerable circumstance and needs a non-essential item that they wish to buy as a discretionary purchase, then they may be able to negotiate with the individual business around a delivery arrangement in that circumstance.
On the issue of schools again, is any work underway to assess the ventilation in schools, consider filtering, how many students can fit in classrooms?
Sure. Yeah. So look, all of that work is occurring. Some of the precursor of that, of course, goes to the air quality issues from the 2019-20 bushfires, and it will vary across school buildings that are of various vintages. There are, as hard as it could be to believe, there are school buildings in Canberra older than me, and there are school buildings that are very recently built that have very excellently designed ventilation systems. So it really does depend on the school setting. But yes, that sort of background work has been occurring in relation not only to the spread of infectious diseases, but also in relation to bushfire smoke.
And would the ACT consider compulsory mask wearing for students who are probably younger than the mask wearing requirements have been so far?
We could consider it. Have we made a decision on it yet? No, it's a bit of a hypothetical at the moment. Any other questions for me? No? Okay, well, thank you very much. I will be off to National Cabinet and questions for Health Minister or Chief Health Officer?
Of I've got questions for the Health Minister.
And I've got questions for the Chief Health Officer.
Okay, why don't we start with the Chief Health Officer, who needs to be at AHPPC, and then we'll go to Minister Stephen Smith. Thank you very much, everyone.
Chief Health Officer, are you able to provide an update on the total number of unlinked cases in the outbreak so far and how those investigations are progressing?
Look, I don't have in front of me the total number of unlinked cases, and it's more than the number notified today, but it's less than, say, 20 or 30. So let us continue to work through that over today and tomorrow, and very shortly we'll be able to provide a more wholesome update to you on that.
There are more cases that have potentially been infectious in the community in today's case numbers. Are you confident that they present a fairly low risk to the community given the public health restrictions that are in place more broadly?
At this stage, I don't have enough information on which to make that assessment. The teams are working very hard to collect as much information as they can about where and what the circumstances were about when they were infectious in community. But you are exactly right in terms of the current settings mean that the impact will be less than we saw prior to the lockdown in terms of the number of people impacted and the number of people who will need to go into quarantine.
Hague Park has been added as a potential exposure location in the list. It's perhaps one of the first where it's an outdoor setting. Do you see more locations like that being added and sort of what is the risk profile for those outdoor locations?
So I'm not across all 430, I think, or however many it was, exposure sites that are listed. However, you are right. Generally, outdoor settings are considered to be lower risk, but we did see in Victoria some of those outdoor stadiums, which we had always thought were lower risk, as needing to just be increased a little bit in our risk profile. So I think if nothing else, we just need to continue to reassess the evidence that we have as we accumulate that and understand more and more moving forward.
Coleman, are you able to give us an age range of our active cases, the youngest and the oldest?
I can do that. Actually, I can't do that today, but I can tell you that the majority of people, as we've discussed before, are below 45 years.
Provide any more information about our cases who are in hospital, vaccination status, how old they are, any more information about those 11 people?
So we have 10 who are adults and 1 who is a child under 12 years of age, and the vast majority are either unvaccinated or have only 1 dose. And as we talked about before, that links to the age profile that we're seeing and the vast majority of cases, including those hospitalised, who are under 45 years of age, even younger, and have had less opportunity to be vaccinated.
19,000 people checking into Bunnings in one day. When you heard that figure, did it kind of seem like Canberra people were taking the...
Yes.
taking advantage?
Look, I think everyone has... Let me say that being in lockdown is not easy. And I absolutely understand that people are looking for the opportunities where they can to get out of the house and potentially make lockdown easier. So I'm certainly not making any judgment calls on this. What I found looking at those numbers is, for me, that is the biggest flag risk at this point in time. And if we are going to actually have to moderate our restrictions and share the risk across the board, that was one that was really easy to think through. How could we still give everybody access to what they needed without actually having large volumes of people walking through, and not only providing a risk to community, but also we need to look after the staff in those stores as well. So I think those were the considerations.
I'm just interested in having a bit more of an understanding of how we're managing our COVID patients in hospital and the rest of the patients we have in hospital. Is that a question to put to you or the Health Minister?
So I think... I'm not sure exactly what you're asking for there, but certainly our patients in hospital are cared for from a two-pronged approach. One, we have very strict isolation precautions and infection prevention and control requirements in place. The hospitals have been planning this for a very long time, and this isn't the first time that we've had infectious people in. We've always had measles, we've always had tuberculosis, so we're quite familiar with how to manage in hospital systems. The second thing, they will be getting the treatment that they need on a scale of supportive measures right up until intensive care. But I think if there's any more questions, maybe we can take those away and answer them afterwards.
Yeah, I'm just trying to understand, are the freedoms of other patients being somewhat restricted to keep them clear of the COVID positive patients? And are we also testing all of the patients in hospital for COVID as a precaution?
So, since COVID started, we have been testing everyone who presents to hospital who presents with any symptoms compatible with COVID. In particular, we're looking at people who have infectious diseases, respiratory infections, all of those kinds of things that make us concerned. This has been a really useful surveillance exercise. We're not currently surveilling all people in hospital at a concern about exposure from the patient. We have confidence in our systems. We have a COVID ward which has been set up, and that is where exclusively these patients are staying unless they need to stay in another location due to their treatment means.
In terms of testing numbers, are you still confident that it's an accurate reflection of level of COVID in the community?
So I think testing numbers will reflect day 12 and 13 testing, and so I was a little surprised at the lower number yesterday, but that should bounce back today and tomorrow, I think. I still think that we need to continue to drive testing to enable us to detect these undetected chains of transmission.
We've seen in Sydney some deaths from people waiting too long to seek help for COVID-related symptoms. Has that happened with any of the patients we have in hospital, particularly with the one in ICU? And with growing hospitalisation here, what's your advice to people who are sick and perhaps even undiagnosed?
I think it's a really important message that while, as New South Wales has been saying, their system is under pressure, ours is a little bit under pressure, but this does not mean that people cannot go to hospital, cannot seek care. It's really important that if you are unwell and you need to seek care, please do that. If you are not too unwell, remember, call your GP, set up a telehealth appointment. There are other options, but if you are unwell and you need to go to hospital, please go to hospital. Please do not wait. You need to have that done.
The patient in ICU requires breathing support. What does hospital care look like for those who aren't quite as seriously ill and are in the lower category, I guess you could categorise it as?
So I think it's a range. If anyone's been in hospital here, I think it's a range of all of those normal supports that we can provide. Sometimes it's about closely monitoring because we're concerned that that person may rapidly deteriorate, and that may be if they've got quite a number of underlying comorbid conditions. We're a bit scared that they would go off and decline quite quickly. So a lot of it is about they might be requiring medication that we can't give to someone at home, or they may be requiring oxygen 24 hours, which we can't give at home. So there's a range of different treatment interventions. With respect to your previous question, though, I would like to give a shout out to the COVID Care at Home system that I believe Minister has talked about before. This is a really important system in which we're monitoring and providing COVID care to cases in the home environment. Clearly, we really don't want to be taking people into hospital unless they have to for their own care needs. They're best to care for them in their home. And the intention of this is to at least do a daily check-in with cases in their own homes and check in and give them a line to be able to come back into the care system if they do feel that they're deteriorating or if they need additional care at any point in time. Thank you.
Minister, could we get an update on Condamine Court? Just recently, an hour or so ago, ACTCOS was demanding an improvement in the government's response after hearing what it describes as distressing stories from residents.
Yeah, look, obviously I'm disappointed to read that in the ACTCOS media release. Canberra Health Services and our broader health team will be meeting with a range of community sector organisations and partners, our non-government partners, this afternoon at 1 o'clock. That includes ACTCOS. That will be an opportunity both to brief those community partners on what is actually happening at site, because I think part of the concern is not actually knowing what is being done through the multi-agency response response. As we've talked about before, ACT Health, Canberra Health Services, Housing ACT and our non-government partners have all been on site working very closely together to provide support to those tenants to ensure that they can quarantine safely and that their various needs are met. As I talked about yesterday, I think we had a very strong initial response, and now we're in a circumstance of trying to settle into what is going to be a longer-term response over the next 10 days or more. And there have clearly been a few bumps in the road in relation to that. And some of that, I think, comes down to communication issues as much as it does to making sure that we're really understanding the needs of the tenants. So I want to acknowledge the very important role that our non-government organisation partners have played and will continue to play in this response. And the meeting today will be really important, both to share information with them about what the government agencies are doing as part of the multi-agency response, but also to get their feedback on what they think is working, what is not working, as well as where they could help more. I know some of the feedback that I've received from them has been that offers of support and help haven't been accepted, and there may be a reason for that, or there may be that hasn't been communicated through the right channels or to the right people, or it's still under consideration. So those are the kinds of issues that will be discussed at the meeting at 1 o'clock, and I'm hoping that that will mean that everyone comes back onto the same page about the comprehensive response that is being provided for tenants in Condamine Court. But certainly we continue to take that really person-centred approach to ensuring that tenants have the support they need to quarantine safely, and that response is meeting the diverse needs of tenants across that site, because people actually have quite different needs depending on who they are in that site.
We've just heard from the Chief Health Officer that the ACT hospital system is under a little bit of pressure. Could you provide an update on where the hospital system is at, how many staff are still in quarantine and unable to come to work, and how soon the ACT might need to expand its COVID wards?
Yeah, look, I don't have that updated number on the number of staff who are in quarantine or isolation at the moment, but it is definitely coming down. It has been coming down day by day, and given that we saw a reduction over the last 48 hours of 7,500 people who were close or casual contacts being released from quarantine, as Dr Coleman talked about, that also means a range of secondary contacts being released from household contacts being released as well. That will have a significant impact on reducing the number of healthcare staff across Canberra Health Services and Calvary who are offline. And I know I heard from one person that one of their household members had gone back to work at midnight when they were released from quarantine overnight. So definitely the health services working with those people to ensure that they can come back to work in that safe and structured way, and they'll be absolutely welcome back into the workplace. In terms of the broader pressure on the health and hospital systems, we have seen a reduction in the number of people who are presenting to the emergency department, but we've also seen an increase in the stringency with which those COVID-19 screening measures and support measures have to be put in place at our emergency departments. So we are continuing to see a bit of pressure there. In terms of the number of patients that we have in hospital, it is absolutely manageable at the moment. And again, I want to give a shout out to the COVID Care at Home team, but also to all of our hospital staff who, as Dr Coleman has said, are very used to managing people with infectious diseases in that hospital setting and used to managing infection prevention and control. But I recognise that this is a time of stress and anxiety for our hospital staff. In some ways, the reality of it sometimes helps to understand what is going to happen as opposed to thinking about what might happen into the future. But yeah, great shout out to our hospital staff who are managing this situation very well. And again, to echo Dr Coleman's thoughts around or comments around ensuring that if people do need to attend hospital, that they do so.
How concerning is it that the number of people in hospital just continues to grow day by day, especially now we've got a young child in hospital?
Yeah, look, I think with the number of cases that we have got now, over 200 cases, it's not surprising that we're going to see some of those people in hospital. I think the first time, through the first wave of COVID-19, about 20% of people ended up needing some kind of health care, and then a much smaller proportion, of course, needing intensive care support. So it was always expected that once we started to see this kind of case numbers, we would see people in hospital.
Are you able to say how many Canberrans are still waiting for a notification so that they are able to leave quarantine? And are you confident that ACT Health has enough staffing capacity to process those release notifications?
Yeah, so I can't tell you how many are currently waiting a notification to be released from quarantine, but what I can say is over the last 24 hours there's been an incredible amount of work going on to ensure that some of the issues that have been identified by the Chief Minister in the process of matching up those negative test results with people's records in our contact management system, that work has really been underway. And so I think around 7,000 people got a release notification last night. About 4,000 people got a text last night saying that asking them to undertake an extra process to upload evidence of their negative test result so that that could be matched with their contact tracing record to ensure that they could be released. And when I received advice at about 7 o'clock this morning, already about 850 people had been processed through that system from 5 a.m. this morning. So there is a lot of work has been done to ensure that those issues could be addressed, and some more work is going on to understand what some of the underlying issues were in those connections between. We have multiple pathology providers that then need to link into our contact tracing client management system, and as the Chief Minister said, if people didn't have the exact same name, same date of birth on the two records, they weren't necessarily automatically matching up and providing that tick. We have also seen some people where their request or their information and request to be released from quarantine has been rejected because there was no evidence that they had in fact done that day 12 or 13 tests. So if you're in quarantine and you think that it's time for you to be released but you haven't done your test, just a reminder that you actually have to have a negative test. It's not just the 14 days.
Minister, you mentioned that there was a technical glitch to blame for this. We've heard that the kind of calls are being made from a call centre in Western Australia, and one of the problems is that all of the people in quarantine, there are replicas, up to 4 or 5 replicas of their profiles in the system, so the workload appears 5 times bigger than it should. Can you provide any clarity? Is that the case?
So I think you're talking about two different things. So the issue around the technical issue was around being able to data match, as others have talked about, between the result that was coming back from pathology and the information that was in someone's system. We absolutely have, and we've talked about this before, we absolutely have both Western Australian and Tasmanian contact tracing teams supporting our contact tracers, but they're working off the same database. I'm not able to comment on whether people have replica records in the system. It may be that they've been in quarantine more than once and we have multiple records. I'm not able to comment on that level of technical detail, I'm afraid. Okay, thanks everyone.